Chronic stress and poor sleep are at the root of so many health issues. But between work deadlines, family responsibilities, and everything else life throws at us, finding calm can feel impossible. That's why I formulated Steady Spirit, a comprehensive stress and mood support supplement from my Adapt Naturals line. It features clinically backed doses of 5 powerhouse ingredients like Afron saffron, Sensoro ashwagandha, Relissa lemon balm, L-theanine, and holy basil to help you manage everyday stress, promote a sense of calm, achieve focus clarity during the day, and support better sleep at night. Just 2 capsules a day deliver real results. Reduce stress, a calmer mind, improved mood, better focus without jitters, and more restful sleep, with noticeable benefits in as little as 2 weeks. Visit adaptnaturals.com to learn more about Steady Spirit and take the first step toward going from wired and tired to calm and clear, naturally from the inside out. Hey everybody, Chris Kresser here. Welcome to another episode of Revolution Health Radio. I've talked on the show before about the link between metabolism and mental health. In fact, I had Harvard psychiatrist Dr. Chris Palmer, who's been a pioneer in this field, on the show to talk about metabolic psychiatry and his brain energy theory of mental illness. So I was really excited to welcome Dr. Matt Bernstein as a guest on the show today. He's a psychiatrist as well. And in fact, his initial exposure to the idea of a link between metabolism and mental health came from listening to a lecture from Dr. Chris Palmer about 10 years ago. And he also had 2 of his sons were struggling with mental health conditions related to mold and Lyme, and was not finding any answers within his own profession of psychiatry and within conventional medicine as a whole, and heard Chris Palmer's lecture. And that just really opened up some doors for him and led him down the path that he has been on for the past several years, which is treating patients with mental health and behavioral disorders with a ketogenic diet with great success. And he's actually started a residential program called Accord in the Boston area that helps people to implement this approach, and is just having remarkable success, which we talk about in the show. So we cover the evidence behind a ketogenic diet and mental health, what's happening in the brain in mental illness mechanistically, and why providing ketones addresses that, how ketones improve mitochondrial health in the brain, what populations and different conditions benefit from this. We talk a little bit about kids and teenagers and young adults and specific considerations there. I really enjoyed this episode. I think it's going to be super helpful for all of you listeners, anyone suffering from mental health or behavioral issues themselves, or parents who have kids or teenagers that are struggling with these issues. So without further ado, let's dive in. Dr. Matt Bernstein, it's a pleasure to welcome you to the show.
Thanks for having me.
So I'd love to start by just learning a little bit about what got you interested in the metabolic approach to psychiatry and mental illness in the first place. I've had Dr. Chris Palmer on the show a while back. I know he is a colleague in your space with a similar interest, and I'm just curious, what led over your career to this focus?
Yeah, always a good question. So there's lots of length versions of the story. I'll give you the sort of shorter one at this point. At the time, I had 2 kids. We have 3 boys, but 2 of them had gotten sick with a pretty unexplainable illness, which we later figured out to be autoimmune encephalitis from mold and Lyme.
Mm-hmm.
But at the time, we didn't know that. So I'm sitting, with all of this in my mind, trying to figure out what's going on with my kids, and medicine wasn't helping them. Regular medicine wasn't helping them. And I'm in a grand rounds lecture, and actually Chris Palmer was giving the grand rounds about using the ketogenic diet to treat treatment-resistant schizophrenia and bipolar disorder. And I was very receptive to the message at the time. I think I may have been one of the only people in the audience who actually understood and believed what he was saying, because it was a pretty skeptical crowd, I think.
Were you receptive because of your sons, your experience with your sons, or also were there other things in your career, like maybe the traditional approaches to treating mental illness were not as successful as you would hope they would be in your patient population?
Definitely both. Yeah. I mean, I'd always had my eye on, I always worked with people with more severe illnesses, and I always had my eye on people really getting back to life, having a functional outcome as opposed to just reducing symptoms, which is what generally, mainstream medicine cares about. We measure these symptom rating scales in psychiatry, and we say this drug works if you can reduce the symptoms, but it doesn't take into account all the side effects, metabolic effects that are happening, which eventually end up leading to, even if the symptoms are better, the functional outcomes are not very good most of the time, meaning people are not getting back to work. They're not getting back to living independently. The best we can hope for sometimes in these more serious illnesses in the mainstream approach is keeping someone out of the hospital and, keeping their symptoms a little bit lower than they were. But unfortunately, tremendous amounts of metabolic side effects, often, huge amounts of weight gain, diabetes, 10 to 20 year earlier mortality than the general population in that population of people. So I was always noticing and very disappointed by all of that. And then, of course, with my kids' experience, where we got really no help from mainstream psychiatry and mainstream medicine in general, I was doubly receptive at that point, I think. Yeah,
Hmm. Yeah, this is what I call disease management versus healthcare.
exactly. Right. Exactly.
Yeah. Okay. So you were exposed to Chris Palmer and his work. You were very receptive to that. And then I imagine that took you down a path of, wanting to confirm and verify that in your own experience.
Absolutely. Yeah. Yeah. First, immediately put myself on a ketogenic diet, felt amazing. But we were still really in the thick of it with our kids. Our kids weren't getting better yet. So we had a lot of work to do on that front. So I really wasn't ready to bring it into my practice quite yet. This was about, I don't know, 8 years ago or so.
Hmm.
Fast forward a few years, our kids got a lot of help through functional medicine and environmental medicine. And I started having the bandwidth to start really researching this and figuring out how to apply it with my patients, and figuring out, what actually works, and what, not only what works, but what really works in the real world. What can they actually do? And so that led me on a journey of trying to figure out and hone various protocols for people using this incredibly powerful connection between metabolism and brain health and mental health.
So let's double click on that. I'm curious how you look at this at this point. Is that the main or even exclusive lens that you look at mental illness through? Is it, or is it, sort of one of a few that you found to be really helpful? In my mind, I'm thinking about, for example, the inflammatory cytokine model of depression, which is
Right.
often triggered by gut microbiota imbalance and intestinal permeability, which then leads to a systemic inflammatory response. Do you include that in this overall frame, or would you kind of put that in a separate bucket?
No, no, it's included in this frame, I think, because what I'm advocating is people not only eat a diet that produces ketones, but that it's a well formulated version of that diet, so that we do need to heal the gut as well. And there's lots of good science about how the ketogenic diet works in epilepsy, because it's been used in that illness for many years. And one of the main mechanisms is actually through the microbiota gut brain axis.
Hmm.
And so, just eating a diet, if you eat, junky keto food and get into ketosis, you're not going to have the same outcomes as if you eat a whole foods version of this. And I do advocate for people who can tolerate it, definitely including a lot of plant material in the diet that produces ketones as well.
Hmm.
Because I think, if it's tolerated, then you're going to all these additional improvements with short chain fatty acids and polyphenols and all the magic that all of those things do for both the gut and the gut brain axis.
So, given that you would include that in the frame, would you say that all mental illness is metabolic? It has, has metabolic issue at its root?
I would say it's the biggest factor in brain health that I have found. And it's the most powerful way to affect brain health that I have found. It's not to say that just a well-formulated ketogenic diet and improving metabolic health is going to cure everything. I don't want to overstate it. There are people who, that's one piece of the puzzle, and we do need other pieces to fall into place. But it is so powerful, and it's such a great foundation to start any further healing journey, because one now has the mental capacity and physical capacity to engage in all of those other therapies. And we have a lot of good therapies in mental health, psychotherapies and various other types of therapies, but people are often so symptomatic and also so metabolically compromised. Their energy is so compromised. They have brain fog. They can't engage in these therapies. And so if we start here, many times, things fall into place. But if they don't, then we at least have that foundation. We have the energy to engage in whatever else is necessary to sort of finish the process.
That's a really good point. I've thought about this a lot in the case, in my practice and working with people with, psychological issues. Is there's often a downward spiral, right, where the depression and anxiety, whatever, then that gets in the way of all of the practices that contribute to mental health, like exercise, good sleep, good diet, etc. And so it's always, the trick is, how do you reverse that and create the upward spiral?
That's exactly right.
Because as you pointed out, like, you can look at study and see that exercise is comparable or superior to antidepressant medication, but it doesn't matter if the person is so depressed that they can't exercise, right? Or they won't exercise.
It's exactly right. Yeah, we see these downward spirals. And then it includes not just not engaging in these important practices that you describe, but also relationships falling apart, work life falling apart. The stresses pile up, the depression gets worse, and that spiral just can keep going down. But this is such a powerful way to reverse that and start getting the spiral to start moving up, and start building off of that.
So I've was quite familiar with the literature on ketogenic diet and mental health up until maybe 2 or 3 years ago. I haven't been paying as close attention recently. So what does that look like over the past few years? Is there growing number of studies looking at these relationships, and tell me about maybe what summarize the state of the evidence, so to
Yeah.
speak, behind ketogenic diet and different mental health conditions.
Yeah, there's continued to be a lot of research being published in the last few years. We can start with a study from 2022 that came out. It was a inpatient psychiatrist in the south of France who put a bunch of people on his inpatient unit who had been hospitalized many times. These are people with schizophrenia, bipolar disorder, major depression, put them on a well-formulated ketogenic diet, a few supplements, nothing fancy at all, like real basic stuff. The outcomes were absolutely unbelievable. He was able to lower their psychiatric medication, their rating scales. They had effect sizes above 3 in all their psychiatric rating scales. And for people who don't know what effect sizes are, antidepressants come in at about 0.35, antipsychotics come in at about 0.6. These are 3 to 3.5 effect sizes in depression scales, psychosis scales, the CGI, which is clinical global impression. So really just fantastic sizes of
Can we
effect
just
sizes.
linger on that for a second?
Yeah,
You're saying that the effect size was tenfold greater with a ketogenic diet than with SSRIs.
that's exactly right. Although, the caveat is that this is an uncontrolled study, and so it's retrospective. So it's not the RCT that, a lot of people are looking for. However, just that anyone who can get someone who's been that chronically ill that well, and do it in a whole series of people. I mean, that intervention is something we all should be paying great attention to. So that was a really cool study that got a lot of people's attention. And then there's been some other ones. Dr. Shivani Sethi from Stanford published a pilot trial in people with bipolar disorder and schizophrenia. These were outpatients, and they didn't give them the diet. They actually just taught them how to do it. So it proved feasibility. Also, reversal of metabolic syndrome, and everyone who had metabolic syndrome in that study. We had amazing results in terms of everyone who was fully adherent to the diet had full remission of their psychiatric symptoms. We had improvements in sleep, improvements in overall functioning. I mean, everything they measured got better. So again, that was maybe 20 something people, but not controlled, but again, really astounding results. And then another one at University of Edinburgh, Ian Campbell and his group, they had all bipolar people in this study who are stabilized. And another study that had incredible outcomes, both metabolically and in terms of mental health. They actually were able in that study to show a dose response effect between the levels of ketones and all types of different outcomes. So the higher the ketones were, the more energy people had, the better mood they had, the lower the anxiety that they had, and really huge reductions in impulsivity correlated with elevating ketones. So that was really cool. That study also had a magnetic resonance spectroscopy component where they were able to show huge reductions in glutamate on these people on a ketogenic diet, which we know is one of the mechanisms of bipolar disorder. And it's one of the ways in which these medications work. But their reduction in glutamate on MRS was higher with this ketogenic diet than has ever been measured with any of the anticonvulsant medications that are used in bipolar disorder. So that was also very, very cool.
Yeah, that's remarkable. I can't say surprising to me, but
Yeah.
remarkable nonetheless.
And then another one just came out this year with college students, which was cool too. So this is depression, college students with depression. And this one of the complaints sometimes people have is, oh, well, you can't get people to do this diet. Well, all these studies are proving that's not true. They were getting people with very serious illness. In this case, they got college kids who are depressed at college to do a ketogenic diet. And again, they weren't providing the meals. They taught them how to cook and make the food. And these kids made the food. They had incredible results on their depression in the course of a semester. So again, the studies just keep coming out. And the ones that are currently going on, there's many going on now that are actually randomized controlled trials. So the people who are saying, well, I'm waiting for the randomized controlled trial. Well, they're going to see those in the next couple of years, which is really exciting.
Yeah. Well, I mean, that's a whole nother conversation of how and where RCTs fit into
I
a
know.
root
Yeah.
cause, comprehensive functional medicine type of approach. I mean, that whole system is designed to study medication, essentially.
I
So,
agree 100%. Yeah. And it's very hard to do an RCT with a diet also.
yeah, yeah, highly problematic.
Yeah, it's very true, but they're still doing them, and they're going to have all kinds of fancy science components with these RCTs that are happening now. Functional imaging and metabolomics and proteomics. We're going to learn a lot more too about the mechanisms and the ways in which this approach can provide healing.
For sure. I mean, still very useful. And I think over time we'll come up with better methods for studying, functional interventions. I know Mark Hyman, at the Cleveland Clinic, they were working on this where they would study, they would compare standard of care to a personalized functional medicine treatment. And, that's not an RCT, but it's a kind of real world way of measuring, okay, what happens if you go to a conventional doctor and take the medications and do what you would typically do versus what happens if you go and see a functional medicine clinician and get an individualized treatment protocol and then just compare the outcomes there. And I think that could be an interesting model here
Absolutely.
to look at. Are there any specific mental illnesses or specific populations for which the ketogenic diet has been shown to be more or less effective? Like, is it like condition that's like stand out,
Yeah.
really, really effective, or a population that's like, for whatever reason, it's not working well in this population. We don't understand why.
Well, we don't have any where we have found that it's not working. Wherever it's been studied, and there's case reports and case series in almost every single mental illness at this point. So spanning schizophrenia, schizoaffective disorder, bipolar, major depression, OCD, even eating disorders like binge eating disorder, and even anorexia, where there's the most skepticism in my field using any restrictive diet in anorexia. But there's actually some really nice data and a couple of big studies going on right now in anorexia. I've seen it be helpful in PTSD for sure. And even in people with, quote unquote, personality disorders, which is a whole controversial topic in and of itself. But a lot of that has to do with affective lability, affective instability. Ketogenic diet's really helpful for that because it really stabilizes neural networks. So we see people just get to a different place and they almost seem like they have a different, they almost seem like a different person in some ways, like a different personality, just a better version of who they were before. So we've seen it be effective in almost everything. The most data is definitely in the more severe conditions. So the conditions like bipolar disorder have probably been studied the most, schizophrenia, major depression. This is where we've seen the most data. But we're also, in every neuropsychiatric condition, so things like autism spectrum disorders, there's data. Certainly in mild cognitive impairment and early Alzheimer's, there's very good data. So, and even in early alcohol withdrawal, there was a really nice randomized controlled trial done at the National Institute of Drug Abuse, showing that people needed fewer benzodiazepines to detoxify from alcohol, and they had much fewer cravings for alcohol. Total, big changes on their functional imaging studies that were done during that study as well. So it really does, seem like it works in all of these different conditions, which sometimes makes me feel like I'm like a snake oil salesman or something. It works in this, it works in this, it works in this, but it really does. I mean, and that's because it's going at root causes of what goes wrong in the brain. The brain, fails when it has energy deficits, and this really fixes all of that by mechanisms that are well studied over the course of decades. Because of the literature in epilepsy, the neuroscientists have been all over this, studying this for many decades now.
Well, that's the key insight there is if you are approaching things from a root cause, then there is such a thing as a panacea
Exactly.
in the sense that because it's if something is addressing a root cause, then by definition that root cause affects many downstream pathways. And I think people understand this about gut health, for example. Like,
Right.
we know now that our gut health affects literally every system of the body. There's a gut skin axis, there's a gut brain axis, there's a gut immune axis, there's a gut eye or ocular axis, there's a
That's
gut,
right.
a gut gonadal axis, there's a gut everything axis, because it's really one of the foundational core aspects of health. So you can say our gut health, if you improve your gut health, everything will improve. And you can say that in a completely evidence-based, research-backed way.
That's right.
Whereas if you're looking at medications that either suppress or manage symptoms, or are basically acting on upstream or downstream pathways, like end results,
That's right.
then it's impossible for a medication like that to have that sort of effect, because it's working. If you were to imagine like a tree, it's working on the far end of the branches, not
That's right.
at the roots of the tree. So, I mean, that makes perfect sense to me. So let's get a good segue into the next question I want to ask, which is, what is going on here
Yeah.
with ketones? So we've established that ketogenic diet is effective for lots of different mental health conditions. You alluded to one of the mechanism, or the primary mechanism perhaps is related to energy, providing energy to brain cells. So, maybe start with like what gets broken in mental illness, and how then does providing ketones as the primary fuel source to the brain fix that problem?
Yeah. Excellent question. I mean, I think first we want to start off with this idea that the brain is the most energy intensive organ in the body. So it weighs about 2% of one's body weight, and at any one point is using 20 to 25% of total energy resources at any one time. So it's an energy hog, the brain. It's where most of our energy goes. So what happens, we know from, again, decades of research, that all of these mental health conditions and other brain health conditions have a component of brain insulin resistance. So I don't know if we want to go into what that means. I'm assuming many of your audience may understand that, but
Absolutely, let's do it. They're geeky.
yeah. So insulin does many things, but one of the main things that it does, it brings glucose into cells. And when the brain cells, the neuron, becomes insulin resistant, it essentially means that even if one just had a big carbohydrate meal and there's glucose bathing the neuron, it can't get that glucose in to use as fuel. And so it's literally starving for energy. And that fuel source that it's used to is just right outside. It can't come in because of that insulin resistance. Insulin resistance develops over time because of many factors, but a lot of it has to do with, how we eat. And we've been told to eat, 50% or 60% of our calories from carbohydrates, and people are eating 6 times a day, and their insulin is high all day long. And eventually those cells, because they're seeing insulin all the time, become resistant to that signal, essentially. And so we're thinking about that. This neuron that's starving for energy, it can get dysfunctional in any way possible. It can get hyper excitable, it can get hypo excitable, and that can then manifest as any one of these mental or neurological illnesses that we've talked about. Ketones do not need insulin to get into that neuron. So, once someone switches over to a ketogenic diet, those ketones just slip right into the neuron, no need for insulin, and provide this wonderful source of, or an additional source of fuel. The brain never stops using glucose, but now whenever it is running out of energy, that neuron can pull ketones in, have enough energy, and that stabilizes that network, that neural network. So that's a huge and important component. In addition, because we're on this ketogenic diet and we're not eating carbohydrates all the time, we can actually reverse that insulin resistance by being on the ketogenic diet. So we solve the fundamental problem that caused us in the first place, and then we have to talk about mitochondria. So mitochondria are a huge part of this story. Mitochondria, obviously, the energy factories in the cell, but they do way more in all cells, but in neurons, way more than just producing energy. And ketones are a signal to mitochondria to make more of themselves, mitochondrial biogenesis, and to go through mitophagy, or recycling of the old damaged mitochondria. Ketones are a direct signal to cause both of those things to happen. And so we improve the health of those mitochondria, we make more energy, but also mitochondria are involved in expression of genes in the nucleus of the cell. They're involved in the first step of hormone synthesis. They actually huddle around at the end of neurons and cause the neuron to release those vesicles filled with neurotransmitters. So they're involved in neurotransmitter communication, and they're involved in inflammation too. They initiate inflammation and they help resolve inflammation. And so when the mitochondria become dysfunctional, which is a hypothesis of what's going on in all of these mental health conditions, we make them functional again, and we get an actual healing process going on. So this is huge. In addition, we reduce oxidative stress in the brain. We reduce inflammation in the brain, and we change the GABA to glutamate ratio. We talked about glutamate going down in that one study, but we also increase GABA through the ketogenic diet. And finally, ketones actually cause the expression of BDNF, brain-derived neurotrophic factor. So we can have this wonderful stimulus, so these neurons will connect with more neurons and create flexibility in the brain, which essentially is what creates mental health, is the ability for the neurons to be flexible and change when they need to. So all of these mechanisms have been studied and elucidated for decades. Even though the metabolic psychiatry field is new, we know these brain health mechanisms from the epilepsy literature.
Right.
And so we have so much science behind all of this.
And even other studies on other conditions, like we know exercise increases BDNF in the brain.
That's
It's
right.
one of the primary mechanisms by which it helps. And
Yes,
there are issues with BDNF and dementia and Alzheimer's, and
that's right.
And so you can leverage this other research that's already been done to extrapolate how those mechanisms would produce a benefit. That's interesting.
And of course, exercise is very synergistic with the ketogenic diet. And I'm
Of
trying to get
course.
people, but once people are in ketosis, people who didn't feel like they could exercise all of a sudden now can exercise. And so then we
Yeah.
get those synergistic benefits as well.
If you've been feeling overwhelmed, on edge, or lying awake at night with racing thoughts, and you're looking for a natural solution that actually works, it's time to try something different. I'm talking about supporting your stress response from multiple angles, and that's exactly what Steady Spirit is designed to do. This isn't just another chill pill. Steady Spirit combines 5 clinically studied ingredients, including Afron, saffron, Sensoril ashwagandha, Relissa lemon balm, L-theanine, and holy basil, each in the exact doses shown to support healthy cortisol levels, promote positive mood, encourage calm focus, and improve sleep quality. Unlike most stress supplements that underdose or only target one pathway, Steady Spirit addresses it all: neurotransmitters, stress hormones, brain waves, and your natural sleep wake cycle, based on my 15 years of clinical experience in functional medicine. If you want to feel like yourself again, calm, focused, and resilient, visit adaptnaturals.com and try Steady Spirit today. Your mind and body will thank you. So what sort of results are you seeing in the populations you work with? And, everything from like, if you're working with patients and you start them on a ketogenic diet, or somebody who's listening to this wants to start a ketogenic diet and they're on medication, obviously we want to advise them to speak with their practicing clinician, whoever prescribed the medication. But the reason I'm bringing this up is I think it's important for people to know that, if they start doing one thing that improves their mental health, they have to pay attention to the dose of the medication they're taking may need to change as a result of that. So can you speak to that a little bit?
Absolutely. Yeah. And of course, people who are taking these types of medications for these types of conditions, many of them already feel that they don't want to be on these same doses of medications forever. They don't feel well on them. They feel sedated. They feel slowed down. They feel cognitively dulled. They may have gained, 40 or 50 or even 80 pounds since they started taking these medications. They may have developed prediabetes or diabetes and hypertension and all these things. And I agree with you. People can't take matters in their own hands and just start lowering their medication. It does need to be done in conjunction with a medical professional. That being said, let's talk about what's possible, which is very, very exciting. So people often come into the program that I run called Accord, and they're on really high doses of multiple psychiatric medications. Often people come in on 4, 5, 6 medications at a time, doses where they often can't stay awake. And yet they still have symptoms. The whole point of these medications, we think, is to lower symptoms. But, what's going on out in the field is that people are just adding more and more medication, even though the symptoms aren't getting better. So we'll start them on a well-formulated ketogenic diet. We have a dietitian local who's right in the program who formulates it for us, often usually using a 1.5 to 1 ratio to start. Sometimes we'll go up to a 2 to 1 ratio. We're trying to target ketone levels around 1.5 or 2 or higher, depending on the condition. People are often able to get to there by the second week, maybe the third week, if they're not exercising. We try to get people exercising, doing some mindfulness practices, which is also a very important part of all of this. We can talk about mindfulness and mitochondria a little bit later if you want. And then circadian rhythm alignment as well is very important. So getting up in the morning, seeing sunlight, getting outside multiple times a day to be in the sun, and then, blocking blue light at night and getting to bed at a reasonable hour, which is also something that people generally aren't doing before they come. And we can start lowering medication often in the first month. And I have seen the ability to get off of, 1, 2, 3, 4 medications over time. Eventually, even some people getting off all of those medications. It can take quite a while. It needs to be done carefully and slowly with a professional who understands how to taper medications, because all of these psychiatric medications do have withdrawal effects. We think about withdrawal effects with SSRIs, but all of them, the mood stabilizers, antipsychotics, they all have withdrawal side effects, which means we have to go slowly and carefully, but we can steadily keep reducing these medications. People's symptoms go down, their energy goes up, their mood goes up, and that people say, I can think again. I feel like myself again. I can't tell you now how many people have come and said, this is the most important thing that's happened to me in the last 25 years is doing this treatment program, because I felt like I wasn't living life for that entire period of time. And now I'm like, I can live again. And sometimes that response doesn't take that long. I mean, we can sometimes get that kind of perspective after 2 months. It's amazing how powerful it is.
That is pretty incredible. When we talked earlier about, populations, I'm curious about kids. And,
Yeah.
obviously there's a lot of research on ketogenic diet being incredibly effective in the context of refractive epilepsy, for
Yep.
example. Kids who are on, and for the medications for that can be brutal. The side
Yeah.
effects can just be so rough, and even young kids, are able to do this. So I'm not sure if you work with kids in your practice. I mean, obviously you have your own kids and their story,
Yeah.
but how is this, what's your experience been like with like kids and teenagers, for example? Of course, there are particular considerations with kids who are still growing,
Yes.
and how the diet may need to be modified for them. But I know a lot of parents listen to this podcast and they're going to be curious about whether this is applicable for their kids and teenagers.
Absolutely. Yeah, it's a great question. I don't generally treat kids, but I do know the literature about this, and so we have this wealth of information about treating kids with ketogenic diets from the epilepsy world. And one important point to make in the epilepsy literature is that not only when these kids go on the ketogenic diet can they come off all of those medications and retain seizure control, many of them only need to be on the diet for 2 or 3 years, and then they can come off of it and retain all of those benefits. So it's literally, a permanent healing of the brain for kids. So in childhood is really the best time to undertake this because the brain is still developing and growing. It's still very plastic. We haven't developed all these problematic networks that can develop eventually in late teens and 20s. So this is a wonderful time to think about this kind of approach. And often the mental health conditions are not quite as far along as what I'm describing. I'm talking about full blown psychosis and mania and depressive episodes with suicidal ideation. With teens and kids, often we're talking about usually the first symptoms being attentional issues and anxiety that start developing. And that's a wonderful time to think about using this kind of approach because we wouldn't even necessarily need to achieve high levels of ketosis to treat those types of conditions. It could be a fairly low ratio of the diet. It's the hardest part is actually, convincing a teenager to do this kind of thing. But, if you can, if parents can catch their kid before they get into that those willful teenage adolescent years, they may be able to get them on the right path early on and get them feeling better. And then, hopefully that young child, turning teenager understands how important this is, that this is the way they were feeling before, and this is how much better they're feeling now, and really make that connection that the diet and the exercise and the mindfulness practices are the things that created this great feeling and great life for themselves.
Yeah, the middle school and teenage years are definitely the hardest because before
Yes,
that, the parents have quite a bit of control over what kids are eating,
that's right.
and then by college, I think most young people are generally a little more able to make the connection between what their
Yeah.
behavior and how they feel, and they're able to behave in a more rational way, shall we we say. But
Yes.
teenagers and even late middle schoolers are not known for their rational behavior, and there's a lot of differentiation happening and all of this stuff that kind of works against them making good choices in this regard.
It's true, and it's also, they're going against the culture of their friends and what everyone else is eating, and like it's. I'm not saying that it would be easy. It's tough, but there is actually a really interesting study that I want to tell anyone in the audience who's a parent about. They looked at this longitudinal study. It was more than 10,000 kids, studied them from childhood all the way into their early 20s. They were measuring metabolic parameters throughout that whole time, and then eventually measuring mental health outcomes in their 20s. And the results were really incredible. So the kids who had the highest insulin levels compared to the lowest insulin levels at age 9, more insulin at age 9 led to a threefold increased risk of schizophrenia in their 20s. So
Um,
just having the elevated insulin from diet, and then the kids who gained the most weight in puberty had a fivefold increased risk of major depressive disorder in their 20s. And so that's how important this is. Metabolic health in childhood eventually leads to severe, mental health risk in early 20s. And so there's a lot at stake. So yes, it's hard, but it's also incredibly important.
Yeah, that's pretty important information for parents to know, especially going back to what you said earlier. Like, we're not talking about disease management necessarily here.
Yeah,
If you intervene early enough, you're actually talking about a root cause resolution, where you lead to changes in the brain that become permanent because they happen during a developmental period where those things are becoming hardwired, or at least softwired. And we know that the brain is quite plastic and lots of changes can happen over time. But I think we can, even the recent research on neuroplasticity would suggest that doing those changes earlier is easier, while the brain
absolutely.
is more highly plastic than it is later, when you've already have those deeper grooves embedded in the brain, if you will.
I agree 100%. Yeah, that's right.
Yeah. So a little bit of, it is a huge effort, especially for kids. But I mean, the college student study that you pointed to earlier shows that it is possible. And I think that even with teenagers, I happen to have a teenager myself. So
Yeah,
like, once they figure out that the change that they're making is connected to an outcome that they care about, I think that's the key to
that's right.
supporting, teenagers with that kind of behavior change. It's like, so you really want this, could be clear skin, for example,
Yeah,
something a lot teenagers care a lot about, a ketogenic diet. If they also have mental health problems, they may be less motivated to try to fix that problem. They may be more motivated to fix the skin problem.
that's right. Whatever motivates someone. Yeah, I often say, my goal as a psychiatrist is to help people's brain health and their mental health. Their main motivation sometimes to do this intervention is to lose the 50 pounds that they gained on the medication that they were taking.
That's right.
Doesn't matter what the motivation is. We can meet in the middle and agree on the plan, and we're all happy. And then in the
Yeah.
end, they'll often come back and say, I didn't believe you about the mental health part, but you were right.
Yeah.
That's actually really, really significant too. I was doing it for weight loss, but actually I feel so much better. I have all this
Yeah.
energy, my mood's better, my anxiety's better, my attention's better, all of it. Yeah,
Yeah. We'll make the weight loss easier to maintain, as you talked about earlier.
exactly.
Let's finish by talking a little about some specifics. There certainly is a spectrum of ketosis, and
That's right.
how many ketones are produced, and there are different methods for getting into ketosis, and there's different approaches to ketosis, like within, for example, that you might do with recalcitrant epilepsy. You have to really be in deep ketosis in a
That's
lot
right.
of cases to get the benefit. Whereas with weight loss, for example, you may not need to be at that level of ketosis to get a benefit. So what do you target in terms of ketone production and the sort of level of ketosis for mental health outcomes?
Yeah. Well, and of course, we're measuring beta hydroxybutyrate, which is one of the main ketones. The best way to measure that is with a little meter that measures a little drop of blood. So it's similar to like what a diabetic would use to prick their finger and put it in the meter. And we think about therapeutic ketosis starting at about zero point 0.5 for things like mild to moderate depression, anxiety, maybe some mild to moderate ADHD. I would target around zero point 0.5 to 1 as being adequate for most people with those types of conditions. For people who have a more severe depression, for people with bipolar disorder, schizophrenia, like I said, we're targeting more like 1.5 or 2 at least on their beta hydroxybutyrate. But the caveat that I would say is that beta hydroxybutyrate fluctuates throughout the day quite a bit. And so we're only getting this one snapshot. And so we have to be careful not to make too much of the numbers, because they're going to change quite a bit. We know this because now some people have the access to these continuous ketone monitors, which are really cool, which unfortunately are not approved in the US yet. But I had someone who got his hands on one, and over the 2 weeks, it was remarkable. His curves were, early morning, his ketones were only about 0.6, 0.7. By the, later in the day, they were up to 2 in the evening. By the middle of the night, they were all the way up to 4. And so it really depends on when one's measuring them. They're very dynamic. We're making ketones all the time, but then we're using them all the time.
Hmm.
And so it really changes with the circadian rhythm as well. And probably, connected to all the other hormones that we're thinking about. So, suffice it to say, you have to have a little bit of experience, in figuring out exactly what these ketones mean, these ketone numbers mean. But we definitely need to target a little higher for the more severe conditions. And generally, if people want to measure the same time every day, probably the evening is the best time to measure to get a nice sense of where one's ketones are. If you really wanted to do a good experiment, you can, maybe for a week, measure them maybe 3 times a day and really get a sense of kind of how they're changing throughout the day as well.
What about ketogenic supplements or compounds like
Yeah.
MCT or leucine is a ketogenic amino acid or exogenous ketones? Have you played around with those much as a way of helping people to get into ketosis
Yeah.
or
Yeah.
to generate ketones?
Absolutely. Yeah, we use MCT a lot. And that's also something from the epilepsy world. MCT version of the ketogenic diet is very popular because it allows one to eat a more standard looking kind of plate of food, but still achieve higher levels of ketones because you can supplement with this very ketogenic fat, the medium chain triglyceride oil. And I like that one because it's still our body naturally turning a food into ketones. And so our liver still now has control over how it's going to do that to some extent, as opposed to exogenous ketones, which are really, you're just artificially, essentially putting this external ketone into your body. And the problem with exogenous ketones too, is that they're very short acting generally. They're now making formulations that last a little bit longer, but still only about 3 hours or so. And so we get the signal of ketones, but we don't get the fundamental metabolic change, that we would get by doing the ketogenic diet, which is having low insulin all the time, reversing insulin resistance, and all of those things that are happening with a ketogenic diet. So, I think exogenous ketones are helpful for sort of performance enhancement sometimes. They may be helpful sometimes for someone just to know what it feels like to be in ketosis. If someone wants to just say, I'd like to see what this feels like. But the hope would be then to transition into a different diet and maybe including some MCT to boost the ketone levels.
Yeah.
I haven't played around with leucine in particular, but I do really advocate people eating animal protein as their protein source when you're doing a ketogenic diet. We talked a little bit about, growth in kids. One of the things people do need to know is that, ketogenic diet is high fat, moderate protein, low carbohydrate, which means that you can't just eat protein all day and be in ketosis. Protein essentially causes an insulin response, and the insulin will be too high if you're eating protein, huge amounts of protein all day. And so we keep it more like around 1.2 grams per kilogram of body weight, unless someone's exercising a lot, in which case then they could do maybe 1.6 grams per kilogram of body weight and still get into deep ketosis. But unless someone's exercising a lot, it's more like 1.2 grams per kilogram of protein a day.
That's one of the areas where I found leucine to be helpful is if you add leucine to, let's say, 5 grams of leucine, I found that you can boost protein intake a little bit without affecting ketosis.
Interesting.
I mean, we're not talking about doubling, but, certainly boosting. I'll send you a study on this that was pretty interesting from like back in 2018. That was one of the main things that they were looking at is like, I think it's particularly like in the epilepsy literature, like, and especially with kids, you don't want to have, they were often having to really, really restrict protein
Right.
intake in order to get them into that deep of a level of ketosis, which of course is a little bit problematic for the kid who's still growing and needs that protein for tissue scaffolding and muscle development, et cetera. So leucine is one of the ways that you can kind of mitigate that and add a little more protein. And then more recently, I've been looking at butyrate. There's some interesting research showing that butyrate is as ketogenic or more ketogenic than leucine. And now you can supplement with bioavailable forms of butyrate that are better than sodium butyrate and actually reach the colon intact.
Oh, amazing.
Yeah. So that's kind of interesting too. So I've been playing with adding butyrate and leucine to the ketogenic diet just to support ketosis. And they work, like you were saying, more like MCT or something that's promoting endogenous ketone production rather than just using exogenous ketones, which I think is better long term. So, last question for you. We haven't talked that much about behavioral disorders. You briefly mentioned ADHD,
Yeah.
but there's a growing number of kids who have autism spectrum, are on the autism spectrum, Asperger's, OCD, oppositional defiance disorder, like a lot of newer
Yeah.
diagnoses that are maybe not classically considered mental illness, but are exist on a spectrum of behavioral disorders. Are you familiar with the research on ketogenic diets in those conditions?
Yeah. Yeah. I mean, there's some really nice work on autism and ketones that it looks very effective. In all the studies that have been done, they haven't done big studies yet on that, but it's certainly something that I would strongly consider if I was a parent in that situation, no matter what form of autism, whether it be the more, high functioning or the more profound forms. I would absolutely consider it if you can make it happen. And certainly in ADHD, I see this, as being almost like, a magic bullet. I mean, if you could get a kid with ADHD into ketosis, everything is going to get better. Everything is going to get better. And it's such a more holistic and root cause intervention than using stimulants. I've seen many cases of OCD get better, and there's wonderful case reports about it as well out in the literature. So I definitely see OCD as one of the conditions where this is, a great intervention as well. When we get into things like oppositional defiant disorder or intermittent explosive disorder, these are things that are very complicated. And, I don't know if I can speak to those. I haven't seen any work on ketogenic diets in those, but,
Yeah.
The way I see it, again, it's like we're fixing neural networks. There's no reason in the world that if you could try to make this happen, that it wouldn't make sense to try this, because what do you have to lose in a situation like that? I mean,
Yeah.
you're already in a real pickle when you're getting a diagnosis of oppositional defiant disorder in your kid. You've been through a lot at that point. Most things probably haven't worked that you've tried. This is something that ought to be tried, I think, in a situation like that.
Right. And going back to what we talked about earlier, like in conventional medicine, you have a different doctor and a different treatment for every part of the body, and because they're not seen as being related. But every disorder, challenge, whatever you want to call it, that we just talked about is mediated by the brain.
Absolutely.
Right. So if you're doing something that fundamentally improves the mitochondrial function of the brain and the brain's ability to utilize energy, then it's hard to see how that wouldn't provide some benefit in virtually any mental health or behavioral condition. Now, of course, as you said, it doesn't mean it's going to cure it 100%. Doesn't mean that other things won't be necessary. We don't want to be too reductionist here and just say that everything is 100% biochemical. There are obviously still behavioral considerations, environmental factors, and by environment I mean the larger exposome, not just environmental toxins, but just relationships, familial context, socioeconomic factors, et cetera. We're not trying to explain those away and just say that we can wave a magic wand and improve brain energy metabolism and fix all mental health problems. That's ridiculous. But we are, I think, in agreement here that this is a fundamental root cause of mental illness and behavioral disorders that can be relatively affordably and accessibly addressed with this. We're not talking about drugs that cost $3,000 a month. We're not talking about having to see a specialist that you have to wait 6 months to see. We're not talking about crazy expense. We're talking about something that most people can integrate into their lives.
That's right. Yeah, it doesn't have to be expensive. That's another sometimes complaint people have. Oh, well, that's so expensive to eat that way. Not necessarily. Just get the macros right with real whole foods. People have studied this actually in the diabetes population using ketogenic diet in people on Medicaid and food stamps, and they're all able to do it. They just get, they get some ground beef and some veggies and some cheese, and it's all and eggs, and it's inexpensive, and they eat a whole foods version of a ketogenic diet, and they reverse their diabetes. We haven't even talked about how powerful the ketogenic diet is for diabetes. Yeah. but there's another one.
I have talked about that in several episodes in the past. So
good.
People have definitely heard about that. Yeah.
And the one final thing I would say is that people just need to be a little patient when they're doing this too. I mean, I don't want people to think that, the moment you go into ketosis, the skies part and everything is different and the birds are chirping and all the problems melt away. It doesn't work like that. I mean, these networks took a long time to get dysfunctional. Mm-hmm. We get into ketosis and we start often seeing some benefits right off the bat, but the full benefits come, many, many months later. And so month 2 is better than month 1, month 3 is better than month 2. And it keeps getting better, as you go into more and more months. And I would say year 2 is better than year 1 if someone continues to do this. And so the healing just keeps happening. And so when people hear about these, sort of miraculous cases of, people with 50 years of schizophrenia, coming off all their medications and never having another auditory hallucination again, that didn't happen in month 1. It happened over the course of the whole first year or 2. And so that's also a really important point, is that, it does require a little bit of patience and long-term thinking to do this. Yeah.
100%. And it's also just, like you said, an adjustment process where, with keto, some people actually can feel worse in the first few days. That there's the keto flu is real.
It is, although you can largely avoid it with enough fluids and electrolytes. We generally don't see it in our program.
Electrolytes especially.
That's
this is where Element even started in the first place.
That's right.
To address this problem.
But even beyond keto flu, there's keto adaptation. And so your cells don't know quite what to do with this new source of fuel sometimes for a few weeks, and they don't really know everything to do with it. And the mitochondria really don't understand what they're doing yet, sometimes for a few months. And so that's that adaptation process. So it takes a while to fully get the benefits, but it's really worth it.
Great. Well, fantastic. Really enjoyed this. Where can people find out more about your work, Matt?
So one good place to go is the website for this program I've been describing, Accord, and it's ACCORDMH.com, AccordMH.com. People can see what we do. There's tons of information in there, including an academic lecture, a video of an academic lecture that I gave if people want to dive in more deeply in the science.
Let me just touch on this. So this is a residential program, right?
It is. Yes, that's a residential program. People come and live with us, or they can stay nearby and just come during the day and just get all the programming, but stay in their own place nearby. We're right outside of Boston in Massachusetts.
And how long is the program typically for the residents?
4 weeks minimum, and some people stay 8 weeks or 12 weeks depending on their condition. It's not only all the treatment, and we do lots of measurements, but also people are learning the whole time. It's all about learning how to sustain this when they get home. And we even have all types of education for the families as well, so that they know how to help their family member, support their family member when they get home. So that's one place to find me. And then the other place, I'm not on a lot of social media, but I am on LinkedIn. So if anyone wanted to reach out to me individually, they could find me on LinkedIn and reach out. And I always would respond to someone who's got any questions or just wants to discuss anything. Yeah.
Fantastic. Well, thank you so much, Matt. It's been a pleasure. I really have enjoyed the conversation. I know the listeners will as well. And wish you, thanks for doing this work. It's great to know. I wasn't familiar with the Accord program, so it'd be great to be able to refer people to that when they need it.
Thanks so much for having me. It was really fun.
Pleasure. Okay. Thanks everyone for listening. Keep sending your questions to chriskresser.com/podcast question. We'll talk to you next time. That's the end of this episode of Revolution Health Radio. If you appreciate the show and want to help me create a healthier and happier world, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to ask a question for me to answer on a future episode, you can do that at chriskresser.com/podcast question. You can also leave a suggestion for someone you'd like me to interview there. If you're on social media, you can follow me at twitter.com/chriskresser or facebook.com/chriskresserlac. I post a lot of articles and research that I do throughout the week there that never makes it to the blog or podcast, so it's a great way to stay abreast of the latest developments. Thanks so much for listening. Talk to you next time.